All right. Perfect. Welcome, everybody. We're going to start on this lecture, the Primo Vascular System, the glymphatic system, and the meningeal vessels. Perfect. Here we go. So guess who said that the lymphatics are closely and universally connected with the spinal cord and all other nerves, long or short, universal or separate, all drink from the waters of the brain. Something we discovered not so long ago. Anybody can put in their chat who said that? Anybody knows?
Swedenborg.
Nope. A little bit after. He was just 80 still, the founder of osteopathy, right? So we're going to really understand what's going on in the brain. We don't know everything. We never know everything, but there's still many questions that remains, and how all that is going to come from the brain to the lymphatics and the interstitial fluid in the periphery. So we're going to start with the lymphatics just a little bit to understand, because we really are going to work on a glymphatic, and I will explain what the glymphatic system is, lymphatic axis, lymphatic axis, and who officially discovered the lymphatic system was actually Aselli. Aselli was from Italy in Padua, and he was dissecting dogs in 1622. He saw beautiful white vessels, and he thought it was like the Greek described before, some lacteals, some vessels with milk, maybe connecting with the breast, or, you know, and Hippocrates had a lymphatic temperament. So Gasparo Aselli thought we had milky veins, the lacteals. He redissected another dog the next day and could not see these white veins. Why? He remembered that this dog had a huge meal before the dissection. He gave the third dog a huge meal and saw again those milky veins, 1622. He followed them and he created that beautiful plate of the lymphatics. You can see in white all the lymphatics, the mesenteric vessels, and they all come toward this organ L. Anybody knows where those mesenteric lymphatic, where they thought they were converging? What is L as an organ? Anybody can write it down on the chat. We're gonna mute Bev. Yes, it's the pancreas, okay? So that's amazing. At the beginning, they thought this is a whole system now. We're not just feeling like the Greek, seeing a vessel here and there. We have a whole system of milky veins all going to the pancreas. Because of Galen, you know, thinking the blood was produced in the liver, which happened in the embryo. They have still a anatomy that was just imperfect. We had to wait until Rudbeck and Bartholin to get their understanding. Just a little introduction about the history of the lymphatics. Just so you know, this plate is supposed to be the first color anatomical plate in the world. The first colored anatomical plate is from this book. All right. If you want to know more, I'm going to give you a few peer review articles I wrote, not just to be arrogant. It's just because you have a full article here. If you want to get all the details of who discovered the lymphatic system, and you just go on the Chikly Institute website, you look for article on lymph, and you find it. All right, we have a blood circulation, enormous amount, 2,000 gallons per day circulating. You have filtration, reabsorption from the blood system. And if you look here, you have from the blood capillaries, a little bit of fluid that escape every day. You almost have 75 grams 200 grams of protein escaping in the extracellular compartment every day. Now, these protein, some of them are coming into this first initial lymphatics or lymphatic capillary with one very thin layer of endothelium going to pre-collectors and then collectors. Collectors, you can see a valve and a little bit of muscular unit. We're going to go over that and going from nodes to nodes before it come back to the large veins at the base of the neck and going then into the right atrium. So we have like this a circulation of lymph from the tissue back to the heart. But when you look at this schematic, can we really call the lymphatic circulation a circulation? Does it circulate? Circulate means a circle. This circle was discovered almost at the same time we discovered the lymphatics. We understood the blood circulation. That was Harvey, 1628. That's a circulation. But when you look at the lymphatics, unless you introduce the arterial side, the lymphatic don't really circulate, right? It's kind of one-way system. So we use the word circulation, but it's not really a proper term, all right? So we can say fluctuation or something like this. This is a initial lymph capillary. And you can see you don't have, first of all, a basement membrane. And you have opening with those arrows where the lymph enters. So here you have extracellular fluid. As soon as you enter the first lymph vessel, it becomes lymph. And so you have those openings that are about 6 to 7 times larger than opening you have in a blood capillary. So you have a lot of, for example, fat, heavy metals, a lot of protein that are very large that sometimes have a very hard time to come back into the blood compartments, but that are very easily reabsorbed into the lymph compartment. And they have those very special openings, button-like. And just so you understand, when you have lipids or proteins that goes into the lymphatic, they bypass the liver. They go straight to the vein, to the heart. They are not necessarily metabolized by the liver. Even though you have a lymphatic, a lot of lymphatics in the liver, it's probably the viscera with the most lymphatic vessels. You still have a lot of vessels that don't go through the liver, and anything reabsorbed by the lymphatics bypass metabolism through the liver. All right, so this is a blow up. So this is your lymph capillary, and you can see around those lymph capillary, you have little anchoring filaments around them. And it looks like this. You have a lymphatic vessel, and you have around it, these are called oxytalin fibers. They are pre-elastic fibers. And what it does, you know, when you touch a system connected with all the elastic fibers in the body, the beating of the adjacent arteries are going to create movement in the surrounding elastic fibers. Your palpation are going to influence movement of the anchoring filaments and touching directly the lymph vessel. And you can see on this beautiful photo from 1907, you have a lymphatic vessel and you have pre-elastic fibers and connecting to the elastic fibers going all the way to the skin, epidermis and dermis. So the skin is directly in contact with many lymphatic vessels. You can really access and influence these vessels with your hands. The rhythm of lymph is not like the cranial rhythm. The cranial of lymph is a fact of science. We have seen that, you see that in electron microscope. This rhythm can be palpated and can be influenced, and you have many articles supporting this lymph rhythm. This rhythm is mainly created by the contraction of those muscular units that are located in those lymph collectors, the largest vessel, 100 to 600 microns. For example, this is not contracted and this is contracted. So between two valves, you have a muscular unit, and this unit is called lymphangion, the heart in the lymph vessels. Those have been discovered in 1961 by Mislan, the lymphangion. So you have valve, and you have contraction between the valve of those muscular units. You see on electron microscope, when I say lymphatic rhythm is a fact of science, you can really see here, it's obvious, right? So you have lymphangions, 2 or 3 layers of muscles and valves in between, controlled by the sympathetic system with a little bit of a pacemaker type of contractions, okay? So one question, because people are not clear. Oh, let me see if we can see the movie. Yep. Contraction in a rat lymphatic vessel. That's from David Sewicha from Texas. And that is the rhythm that you can attune with your hands. It's slow and about the same frequency than the cranial rhythm. And because it is a pacemaker type of contraction, you could feel this rhythm for few minutes, half an hour after death on animals or humans. Sometimes the lymphatic continue to beat for a little bit. And we say the same thing with the cranial rhythm. So there may be pacemakers somewhere, but we did not find them yet. But for the lymphatics, it's very easy to talk to MDs and scientists about the lymphatic rhythm and what you are doing, because you are following this rhythm. And because this is attached to the skin somewhere, the superficial vessel at least, you are going to be able to feel, palpate some kind of movement on the top of the skin. The movement is a movement that creates a change of 40 to 60 to 80 micron. So the skin is going to move few microns with these contractions. And the question is, how much do you think the threshold for human mechanoreceptor in your hands, how much can you palpate with your hands? Typically, 1 to 3 microns is enough to create something in your hand, a change in your hand, a perception in your hand. Some say even 1 nanometer is enough to create, for you to be able to feel something with your hands. So this, just to give you some science a little bit, Olszewski from Poland wrote the first article in Lymphology number 12 in 1979, 1980, 1981, and he really identified the contraction of the lymphangion, the pressure, etc., etc. So today we have like maybe 800 articles, 600 to 800 between human and animals on this rhythm. All right, this is Olszewski. I find an old picture from a congress. One good question. You saw this contraction of the lymph vessels. What type of muscles do we have on the lymphatic vessel? This vessel, I saw a question, is controlled by different substance, is controlled by the sympathetic nervous system. What kind of muscle do we have? We have 3 types. You have muscular, you have smooth muscle, skeletal, musculoskeletal, you have smooth muscles and cardiac muscles. What type of muscles do we have with the lymph vessels? Anybody knows? Yes, Diana knows. Diana, it is a 4th type, combining a little bit of all of them. Smooth, cardiac, and some receptor that look like skeletal. So it's not a smooth muscles. It is not in the books yet, but one day we'll see that we have 4 types of muscles, at least with the lymph vessels. It's its own type. So this is a dissection video that I did. You can see that those very thin filaments, angel hair, have a dye inside of them. You need to dye the lymphatics because they are transparent. And those are the largest lymph vessels. They're pretty thin, and they're often embedded in fat layer. And those are the largest vessel, the thoracic duct. Okay. So now, very fast, 2 seconds, the touching on lymphedema, one of the pathology of we can have with the lymphatics. It is a lymphostatic edema. I'm not going to go into detail, but it means that we have a mechanical problem in the lymphatic. The lymphatics themselves have been destroyed or impeded or cut by surgery or burn or had a trauma. So some edema, we don't have this problem. Some edema, you have too much fluid. The lymphatic are normal, cardiac edema, for example, but the lymphatic cannot get rid of all the fluids. But the lymphatic are normal. This is not called a lymphedema. A lymphedema is when the lymphatic vessel itself is disturbed. All right. So what we do with our hands in osteopathic, lymphatic techniques, this is a normal flow. For example, on the chest, breast, and arm, everything converges to the axillary node, the node in the armpit. And if you see on the patient, this is the back. The vessels on the left side are converging toward the axilla. It's totally normal. On this side, what is happening? We don't see converging. We see the vessels going away from the axilla. So we have a problem on this side. And when we do this superficial lymphatic mapping, we see that the lymph is creating a spontaneous reroute. And in that case, this woman is not swelling. She has a reroute, one from the axilla to the ipsilateral clavicule, and one from the axilla to the other axilla, posterior axillary reroute. And this is what we can do on a lymphedema or on a muscle or a viscera after surgery on an eye. So the mapping helps you to really tell you the direction of the vessels and the reroute. So on a palpation level, you could feel superficial lymphatics. You can feel deep lymphatics, muscles, viscera, even dura. You could feel the lymphatics of the dura, lymphatics of the heart, lymphatics of the bladder or the prostate. For example, some cancer of the prostate have a lot of PCB and toxin inside and dioxin, and you need to drain. So you can do superficial lymph, deep lymph, or when you map, you can think, oh, I think I'm doing lymphatic, but actually I'm mapping fascia, superficial fascia, deep fascia. Okay, so that's a technique that we learned during the seminar. I'll just give you some ideas and opening your mind what we can do with manual lymphatic mapping, and that's a question. So now we come into a totally different subject. You see how small were the lymphatics. This is the lymphatic, the thoracic duct, the largest lymphatic vessel of a rat. What is the blue vessel within the lymphatic vessel, within the thoracic duct that we see in this rat? Anybody knows? Look at that. You have a thin, this is a lymphatic vessel. Because they are transparent, there's no dye here. It's naked eye. And you can see on naked eye, there's a thin white line here. And the drawing on the right, you can see the lymphatic vessels. And inside of it, through the valve, another vessels. Is that amazing? So when you make a cut, you have a tiny vessel in blue inside a lymphatic vessel. You could have this white vessel, this blue vessel, inside a blood vessel, inside the abdominal aorta, inside the inferior vena cava. So we have an amazing system, and not only this, but you have here your lymph vessels, and you have a vessel going in and out, this tiny vessel going in and out of a lymphatic vessel, or an artery or a vein. So some people already, this is called the Primo Vascular System. What are the chances that we find a totally new type of vessel, a new body system in the body, and it's not very known yet because it's shocking people. So it's called the Primo Vascular System. Okay. You can see it inside, and you can see them, for example, here on this dissection. And in this animal, if you do a dissection like this, or even on human, and you see those floating or transparent vessels, sometimes the surgeon would think it is fibrin. You know, the fibers that's that is nothing important, but it is actually a brand new system of vessels that we missed all these years. All right. So you could see there again with the blue dye. It's called tryptan blue. You have a lymph primo vessel and a primo node along this organ. All right. So I don't know if you realize, it's amazing that we missed a complete new type of vessels in the whole body. So this guy from North Korea, Bong-han Kim is his last name. His first name is Bong-han. Was looking at the chair of physiology, did a lot of work in 1961. In August 1961, he discovered those vessels looking for the acupuncture vessels. He said, wow, I think I discovered acupuncture vessels. And he was able to identify them with a blue dye. And he said, it's amazing. He published in 61, 62, 63, he published 6 articles, 1 book, and everybody was exciting. What is it he's doing? And he even measured the electric potential of these vessels. He found them on top of viscera, inside viscera, around the brain, inside vessels, in the connective tissue. He found them everywhere. He found them on small animals like a hydra, a frog, a batracian, amphibian, birds, many mammals. It looks like it's all over animal kingdom, human. And so he was very excited. He was in North Korea. His institute closed in 1965. We never heard about those vessels anymore. He said they are amazing because they carry a lot of nucleic acid, DNA. So there's a lot of DNA inside of them. And it seems to heal a lot of things in the body. They have a very high healing properties. Then we never heard about it. So that was 1965. Many teams from Russia, China, Japan, and America tried to find them. They could find them, but not always. They use different blue. Bong-han Kim, and later on what we call the Bong-han ducts, were hard to find because Bong-han Kim never explained his methods, and especially what was the blue dye. We had to wait until 2002, so very recently, from people in South Korea reading all his literature, and they finally find the blue, the tryptan blue, and begin to see systematically those vessels. So it was quite amazing. So they begin to look for it, and so wow, now with the tryptan blue, we can see them all the time. And you can see that, wow, electron microscope, we have very flat, elongated nuclei on the cells of these vessels. This is characteristic of those vessels. We don't have this in blood or lymph vessels. And you find that with every animals. So like, wow, we learned something here. And then you have those, what they call the rod-shaped nucleus. And then they begin to see, wow, this vessel, so this is a little blue vessel you saw at the beginning inside the thoracic duct, is different because this duct inside this primo vascular vessel has ductal, microduct inside of it, 10 to 20 duct like this. And for what I palpate, they go in different directions. So you have the elongated nuclei and you have small duct inside the duct. So that's definitely not what we see in an artery, vein, capillary, or lymph vessel. So that's amazing. So that's very different system. And we measure there's different rhythm in these vessels. And we use now very advanced technique to check these vessels. We do the immunostaining, and we see that LYVE1 and D248 specific to the lymph vessels is negative. So it's not a lymph vessels. CD31 specific of blood vessels is negative. It is not a blood vessel neither. We have endothelial cells, epithelial cells. We have very specific different type of rod-shaped nuclei arranged in parallel fashion. This is not a lymph or blood vessels. It's a new type of vessels. So where do we find them? Look at that. We can find them here. Beautiful node on top of viscera, for example. we are trying to map exactly, right now we don't know the whole body mapping, but we find all these vessels. They are here primo vascular vessels along viscera. We have a node here. So you find that on the liver, on the stomach, on the spleen, on the kidney, on all the viscera, in fat layers, on the fascia, you find those vessels. And look, you find them on all the layers of the heart, epicardium, myocardium, endocardium, but also floating inside the atrium and ventricular cavities of the heart, floating vessels, transparent vessels. So we missed all that. It's incredible. And it's like people say, well, it's impossible that we missed so much, but we did miss the primovascular vessels. And we find them around the central nervous system. And what's amazing is inside of it, you have here floating inside the aqueduct of Sylvius, fourth ventricle, and central canal of the spinal cord. You have this vessel right here in blue. You have a primo vessel inside the ventricular system, outside and inside every structure in the body that we know. So what's amazing also, it's in cancer, you have an artery, you have a vein, and you have very, very often in green primo vessels. All right. So now the cancer, cancerologists are interested. Can we inject some medication in those vessels? What are they doing here? And I tell you by experience, when I palpate a patient with a cancer, the primo vascular motility movement is disappear. And you have to restart this system if you really want to help with this cancer patient. So that's very interesting. What's very interesting is what's inside. So it's transparent inside the lymph vessels. We don't have too much lymphocytes in the primovascular vessel. We have a lot of lymphocytes. The vessel with the most lymphocytes are the lymph vessel. Lymphocyte B, lymphocyte T, only 1% of lymphocyte in the primovascular vessels. But you have a lot of granulocytes. You have a lot of neutrophil mast cell, mastocyte, mast cells for inflammation. And you have also a lot of adult small size stem cells. It's one of the vessels with the most adult stem cells. So that's what the property, this vessel heal everywhere because you have stem cells, you have nucleotide, you have DNA, very high level, you have hormones, catecholamines, and you have biophotons. We think these DNA particles that we don't know why with universal vessels with DNA like this inside, nucleotides, they probably carry biophotons. So now you may have pathways of light in the body, in every tissue. Very interesting pathways. And they, if you cut these primovascular vessels, you will reduce muscular contraction. And it's crazy, it's like a crazy story, right? If you cut it, you have much less nervous conduction. If you cut it, you will have, for example, the frequency and the strength of the heart contraction will change. So you create pathologies, create paralysis, muscular paralysis. You create all kind of trouble if you stop these vessels. And when we work with them, that will be one day, we teach them in one of the class we work with motility of those vessels. We, we can feel that they are very also sensitive to emotions, belief system, mind. So, and we know that the cancer probably have some kind of negative belief system at the very core of cancer. And sometimes I think there is a bridge there between, biophotons, emotions, and mechanical property of the body. So it's something absolutely amazing. Somebody asked if we regenerate. We don't know if they regenerate really clearly, but with all those stem cells, they probably regenerate because every other vessel regenerate. We don't know if the nodes regenerate, the lymph nodes. All right, so this is the first system, primovascular system. Again, you have nodes and vessels. It's going to integrate and is present, is ubiquitous in every system, in every tissue in the body. Again, if you want to know more, you have a link right there. So you remember we are going to put this on YouTube, so we can stop, you can see the link, or go again in the website, Chikly Institute, under brain articles, and you'll have a peer review article I wrote with a journal of bodywork and movement therapy. Oh, no, this is actually, this is for, it's a different things. The one on the PVS is under the Journal of American Osteopathic Association. You find it also under brain article. All right, are we good with that? Are you wowed already? It's too much? Shall I stop because your heart cannot take it, or shall I continue? This is all kind of, you know, breakthroughs and a new system that sometimes we don't learn enough. Please continue to wow us. Okay, so the glymphatic system, right? Discovered in Rochester, New York, Jeffrey Eliff found it in 2012, and he found that the tracer injected in the ventricular cavities of mice went into the cortex, the parenchyma of the brain, and then were transported along brain capillary. And you have a little space there, and you call that space glymphatic system, because you have a glia, and that's a blue thing we're going to give you in more detail, and you have a vessel, a blood vessel in red, but the space we're talking about is that yellow space, and it runs very slowly. So it's a glio-lymphatic clearance system, very slow. It's not lymphatics. We're not talking about lymphatic vessels. We're talking about a cute word. It should be, has been called before, peri-articular space, perivascular space, and it's cute. Glymphatic took on in 2012, and everybody used the word glymphatic. So to review, this is the astrocyte, you know, one of the most common glia in the body. The astrocyte, remember, you have like 7 or 8 astrocytes for one neuron in the brain. You have 100 different types of neuron, but many more astrocytes. And the end feet, those long extension here, the end feet of the astrocyte cover 99% of all cerebral capillaries and arteries and veins. So you see, this is the end feet of the astrocyte on one side, the glial side, and then you have a vessel, arterial or vein or venules on the other side. So now you can understand this story. This is the end feet of the astrocyte, and they cover very tightly the vessels. And you have very bad drawings when you have big space. The space between two end feet is 20 nanometer. It's very small. Water can go out, small ions, but this is your blood-brain barrier right there. You have a space, perivascular space, or the glymphatic space in yellow. Then you have your basement membrane inside the brain, only inside the brain, sorry. Basement membrane in green, and then an endothelium of the capillary, for example, or artery or veins. And you have the blood with all its elements, right? So around every arteries and veins, you can have in the brain, and only in the brain, you can have a slow network, pathways that can clear a certain amount of things, right? So you have here on one side of an artery, then you have the fluid going out. Oh, I want to say that to go out of those end feet, you also have something very special. You know, you have active process and passive process to move fluid. Here you have what we call the aquaporine 4. Aquaporine is a water channel, right? You have 4 parts, and they go through the water, and some ions, some osmolyte can go through the ion channel. So aquaporine 4 really helping to drain this fluid. And actually, if you destroy aquaporine 4, you increase Alzheimer and things like this. Aquaporine 4. You have 2 types of aquaporine in the brain. Aquaporine 1 in the choroid plexi, and the 4 here for these lymphatic pathways. So this is a way to transport water. So water can escape a little bit, go through the parenchyma, and this convection is called the flow, going back, taking some waste product, taking some inflammatory product, especially beta amyloid, A-beta amyloid for Alzheimer, draining lactate, anything that you need to drain, boom, going into venous side. And then we're going to see this is going to later on be absorbed by the lymphatics. I hope I meet everybody. I think everybody is good. So we have here a slow drainage pathways. It's not a lymphatic, it's a glymphatic pathway. We could call that a pre-lymphatic system. Okay, so when you look at arteries or vein in the brain, imagine you have a space around all of them inside the brain, and that space is your glymphatic system. So you have a labyrinth of spaces that move from artery to veins and eventually to the lymphatics in the neck. Okay, that's your lymphatic axis of the central nervous system. Okay, so to recap a little bit, the glymphatic system is a slow gliovascular clearance system, and it's not lymphatic, it's lymphatic-like. It's not located inside lymph vessels, so it can be only pre-lymphatics, and it facilitates the removal of interstitial fluid, as well as weight product, beta amyloid, protein, lactate, all kind of things, product of inflammation, for example, or product if you have a clot or something like this. All right, so periarterial CSF inflow. So what's interesting is when you are around an artery, for example, the flow of CSF, the flow of the glymphatic is running in the same direction as the blood flow. And it's propelled by inspiration. That's very important for movement of the CSF, as well as pulsatility of the arteries, right? So this is many things that helps, but it goes with the direction of the blood flow. And eventually we leave that perivascular space, mix with the interstitial fluid. And so I'm talking about this. It's going to leave the yellow space, mix with the interstitial fluid, and is going to be recovered in a perivenous space. Oh, I'm going backwards, sorry. So the process is facilitated by aquaporin 4 water channel present at the vascular astrocyte and fits. And this fluid is eventually going to be transferred out of the central nervous system by meningeal lymphatics. That's our next subject, and that is the lymphatic axis, right? So the CSF flows in about perivascular space about 40 micron in width. These glymphatic spaces could not be seen because you go electronic microscope and they flatten, so you don't see them anymore. You have to see them with new device that we use, 2 photons, so same direction. It follows the pulsation of the artery, and its speed is up to 20 micron per second, right? And you use something like 2 confocal, to see these kind of spaces. So the glymphatic system is a brain-wide network of perivascular spaces that help clear metabolites. What's interesting is this space can be impeded if you have ischemia, traumatic brain injury, stroke, hemorrhage, microinfarction. And we know that's the cause of sometimes Alzheimer, if you have high blood pressure, and aging. It slows down in aging. Okay. So, for example, if you try to block the movement in the glymphatic spaces, that is going to increase amyloid beta deposit, and that could be an early marker of Alzheimer's disease. And if you restore the glymphatic flow, it could be a target to help Alzheimer's disease. And this clearance system worsens with age. All right. So what is interesting? Okay, so beta amyloid clearance in Alzheimer, in traumatic brain injury. We also have tau in traumatic brain injury, extracellular synuclein. So in Parkinson, we have accumulation of synuclein, Lewy body disease. So all these beta amyloid, synuclein, tau, Lewy body, etc. This is what we expect the lymphatic system to target and to clear out of our brain, central nervous system, to help you clear your mind. Now, on the other side, when you sleep, and XIA is the first one in 2013 that found this, when you sleep, your glymphatic spaces widen. They say sometimes 2 to 3 times. So when you sleep, this is an important time to clear your system. They said you have an expansion up to 60%. and you drain much more of your waste product. And they discovered that they were not finding any physiological reason to sleep. This is the first clear reason why we sleep. We need to sleep to at least help clear all these waste product when you sleep using the glymphatic pathways, right? So sleep or anesthesia significantly enlarge interstitial space, okay? So you really help to clear those beta amyloid and all the waste product. Now, anesthesia create problem also. It's not, I mean, it helps you clear stuff, but you know, it can impede your memory and things like this. But sleeping is a very natural way to clear your system. So please have a good night tonight and help your brain clear this waste product. Benefit of sleep could be also to produce more myelin, especially teenager times. You know, you are not completely finished with your myelination process at birth. You continue until 18, 20, sometime 24. And another function of the glymphatic system maybe to transport small lipid in the central nervous system. This is a butter here. It looks like Dura a little bit. All right, so this is a glymphatic system. And again, this is an article. So I wrote on that, all those drawings and everything come from this article from the Journal of Bodywork and Movement Therapy. So you can go on the Chikly Institute website, and on the right, you can see actually brain and lymph articles. Some are peer-reviewed, some are not. So now, after the Primo Vascular and after the glymphatic, the meningeal lymphatics. In 2015, two teams, almost at the same time, using the same types of technique in mice, independently found typical lymph vessels lining the dural sinus in the brain. We have Luvo and his team, and we have Aspelund and his team. All right? So before 2015, that was your lymphatic system officially. After 2015, we have now lymphatic vessels lining parallel to the main sinus in the brain, superior sagittal sinus, etc. So Luvo said, looking for T cells gateways in and out of the meninges, we discover functional lymphatic vessels lining the dural sinuses in the brain. These structures express all the molecular hallmarks of lymphatic endothelial cells, and they can carry both fluid and immune cells, lymphocyte B, T, and macrophage, from the cerebrospinal fluid into the deep cervical nodes. Boom. Big history. Everybody heard of that. What I don't understand, and that was in my book in 2000, is, first here, you can see lining the sinus, you can see the meningeal lymphatics. This is in rat, and this is the type of lymphatics we have. You can see in green, LYVE1, we saw that already, specific of lymph vessels, and CD3 is more for the immune cells inside, right? What I was saying is, what I don't understand is our friend Paolo Mascagni in 1787 talked about, he did beautiful hand drawing and showed the lymphatics of the meninges, of the dura. I don't know what, many people missed it. It took a few months before people catch on and says, oh, right, we actually knew about the meningeal vessel since Mascagni, with his very strong nose here in Italy, you know, he drew these beautiful vessels. And I mentioned that in my book in 2000, but 2015 was the discovery of the meningeal lymphatics. So actually it's like this. In 1869, Schwalbe from Germany injected blue dye in the subarachnoid space of rabbits, CSF, cerebrospinal fluid, and saw this blue dye coming into the nodes of the neck very fast. So actually, initially, we thought the cerebrospinal fluid was reabsorbed in the lymphatic of the nodes. So we have some kind of central nervous system going into the neck lymphatics axis. in 1914, we did a very specific experiment. He used two different solutions, and he kind of showed that the arachnoid villi and granulation were the dominant way to evacuate CSF. So until recently, the main reabsorption of CSF was the venous pole, arachnoid villi and granulation. And the lymphatic pole was very minimized, which changed recently because the more pressure you have in your central nervous system, the more is going to the lymphatic side. And an embryo has cerebrospinal fluid that need to be secreted and reabsorbed, but an embryo does not have arachnoid villi and granulation. The arachnoid villi and granulation slowly appear after death, one by one. So something needs to drain the CSF, and initially our CSF is drained by the lymphatics, and this is probably a more important pathway than the lymph, or at least as important, the lymphatic and venous reabsorption of CSF. So we did 1914, affirm the absence of meningeal lymph vessel has been proved. And so they were rediscovered in 2015. They are especially well developed around the venous sinus and at the base of the skull. Drainage by the meningeal and cervical lymphatics are relatively fast, since tracers injected into the brain of the CSF accumulate in the cervical lymph node within minutes. 10 minutes, 12 minutes, 6 minutes, you can see the dye coming into the neck. So that is the meningeal lymphatics. You can see them in green right here, reabsorbing some of the fluid from the CSF or the parenchyma. There's a lot to say, but let's stay with that. So now we talk about some component of the brain extracellular fluid, some component of the cerebrospinal fluid are going to be found into the lymphatic, especially the lymphatic of the neck, the deep lymphatic of the neck. So let's talk a little bit more about those lymphatics now. How do we do that? What can we do to stimulate the lymphatic system? And I also wrote another peer-reviewed article who discovered the first manual techniques addressing the lymphatic system. Anybody knows who wrote about that? So the first technique about health, we have Sumeria, we have Chinese, traditional Chinese medicine, we have, Ayurveda in India, we have Egypt, you have Greek and Romans, you're doing massage all the time. You have, maybe African medicine, I don't know so much about this, who describe specific technique for the lymph system. I mean by that, we had a little bit of technique that were developed. For example, Swedish massage, you talk about the lymph system, but those are effleurage, they're not specific techniques for the lymph system. Specific techniques were actually described by Andrew Taylor Steele, founder of osteopathy. And it was so concentrated on the lymphatics, and this is the article on also the Journal of American Osteopathic Association. It's also a peer-reviewed article. The lymphatic were so important for him, he said, we are admonished not to wound the lymphatics, to handle them with wisdom and tenderness, and you have to have very gentle technique. Your patient had better save his life and money by passing you as a failure until you know how to deal with the lymphatics. So anybody there listening that doesn't know how to work with the lymphatic with gentleness, tenderness, and wisdom, you better stop your practice rather than continue per AT still, okay? And somebody say, yes, the Greek. We were waiting for the Greek technique on the lymphatics. I mean, sauna, all that is great for the lymphatics, except it's not specific technique for the lymphatics. That we know, but maybe there's some text we don't know from the Greek. They did great techniques there. Look at what he said. A.T. Steele said, we strike at the source of life and death when we go to the lymphatics. No atom can leave the lymphatics in an imperfect state. He has many, many quotes on the lymphatic like this, and he gets very excited about them. They are almost the sole requisite of the body. The lymphatic contains vitalized water. Just a few quotes from him. So later on, we have Miller, who developed the lymphatic pump, and they have the thoracic pump and the pedal pump and the abdominal pump and the splenic pump and the liver pump. And actually, 1920, and actually Sutherland did not like those techniques because they were using a lot of force and they were a bit tiring and took a lot of time. So Sutherland was not so hot about those lymphatic technique, those pump, but they're still used today, and we have a lot of science. You know, they do pump on rats. You know, and Lisa Hodge, for example, in Texas, used to do. You have a lot of study on these techniques. All right. For me, they are not very lymphatic techniques. They are shaking the interstitial fluid until they go into lymph vessels. They don't have the correct rhythm to be a lymphatic rhythm. They don't have the correct, often, direction. So it's like if you shake the bathtub, you shake the water, eventually some of that water is going into the drain. That would be the lymphatics. So for me, they are more specifically extracellular fluid techniques than lymphatic techniques, but they will indirectly for sure help lymphatics and veins to go probably from valve to valve in the veins also. All right. Again, you want to do more about the manual techniques on the lymphatics. This is the link. What else? So what I developed is something called osteopathic lymphatic techniques. And you ask me, how do you map and things like this? Lymph drainage therapy. You have to attune, just like the way you connect with the cranial rhythm. You have now a lymphatic rhythm, and that's not external compression, internal compression. Now we are talking about the longitudinal component, and very, very easy to palpate because you have dermis, you have no vessel, no blood, no lymph in the dermis. Just under that you have, epidermis, no vessel on the epidermis. Under that you have the dermis. So under the dermo-epidermic junction, you begin to have your lymphatics. In a limb, 70 to 80% of your lymph is superficial, above the superficial fascia. So 70% is right there under your hand to palpate. It's very easy to palpate just under the epidermis. In the viscera is deeper. You have lymph in the periosteum a little bit. You have, then the dura is much more advanced. But we slowly learn how to do that. And what I developed is probably the first school, not to brag, but to feel the specific flow of the lymphatic, because I was an osteopath. I am an osteopath and an MD, and I could feel the cranial movement. I could feel a different movement, a different rhythm. Still, same frequency, 0.1 hertz, same frequency than cranial rhythm, but this time longitudinal component under the skin. So I begin to do some study, and this is your lymphatic rhythm, not correlated with breathing and blood, and you have a frequency of 0.1 hertz. This is, I did that in Boulder Creek, California, the HeartMath Institute. You may know this institute. And then I checked to compare with the cranial rhythm, same thing, 0.41 hertz. And then I did the motility of the liver, so visceral motility, very close to 0.1 hertz. So we have three rhythms that are very connected, correlated, brother and sister. They all slow down, and that can become one when you go very deep in alpha brainwave and you relax, and they will all disappear in still point. I mean, if you use a cranial to create a still point, the lymphatic and visceral rhythm will disappear. If you use a lymphatic to go into a still point, the cranial rhythm and the visceral motility will disappear. They all disappear in still point, three of them, right? And so that's the class when we work about things like this: brain, cranial rhythm, and bone marrow. By the way, this class is going to be, I forget when, June 28 to 30 on a webinar. You can do a brain, you can work on still point and the bone marrow motility, how you influence the cranial rhythm, and different way to work on the lemniscate with the cranial rhythm. It's going to be a webinar online. I forget, but it's still, you know, at the end of this month. All right, so you have to follow the specific rhythm, specific pressure or depth. You know, are you working on the fascia, on the muscle, on the skin, on the layer of the eyes, on the dura, on the viscera? You have to know they have different, you know, the skin may be in one direction, the viscera in another direction, the muscle in another direction. So you have to know what you palpate to feel the lymph. Then you have to find the direction. And the direction is a mapping. When you get the rhythm, you can get the direction. We'll talk about that. And then the quality. Is the lymph very thick when you have inflammation, infection, or very fluid like the white of an egg? And the hand technique and the stroke. So you have many things to pay attention, and eventually you are able to map. You map superficial lymph flow, deep lymph flow, and these are 3 articles when I explain mapping. One of them is peer-reviewed. 2 of them are peer-reviewed about mapping. Lymph articles, again, the website. So for example, just to give you a little example to complete, this is very complex. This woman also has lymphedema. She has surgery on the right side. On the left side, everything converged to the inguinal, right? You can see the inguinal nodes are right there, growing nodes. And on this side, some area seems to go maybe very lateral on the nodes, not really here, but laterally you have a little bit of nodes after surgery, still working, but a lot of the lymph of this is going away. And oops, and you can see that the abdomen, for example, is going in very funny direction. So it's very hard to work on things like this. I show you lymphedema because it is very easy to see, but you'll do the same thing on a liver. You have a blockage in the liver, you will have the lymph going the wrong direction. In the kidney, in the adrenal, in the bladder, in the uterus, in the prostate. You can have an appendix inflamed and you have the same situation. You just have to switch the lymph and you avoid a lot of surgery on the appendix for kids, just because you're going to drain and reorganize correct rhythm, correct depth, correct direction, and you don't have your inflamed appendix, and you're going to avoid a lot of surgery. Now, if they still have pain, you go to surgery. You don't take chances with an inflamed appendix. So injury or surgery can create this kind of wrong lymph. Usually when you have a wrong lymph like this, I bet if I do the range of motion on these right legs is very limited compared to the range of motion on the left side. And you map and you reroute, and it goes, you know, takes like 30 seconds, 1 minute. And what happens after rerouting, in blue, you have the new pathways after you map and reroute. And you see that this whole leg now decide to go from the inguinal, is going to reroute. And for the rest of her life, probably this woman will have to drain this leg toward the axilla, and the armpit are up there. So her right armpit is going to always drain the right arm and the right legs. And that's okay. You can have even 2 legs and 1 arm in 1 armpit, and that's the way it drains. Okay, so that's just give you an idea. If you have 2 minutes, yeah, if you want 2 minutes, I can show you a little video, an old video, how I map the lymphatic pathways. It's on YouTube, and you can easily find that on YouTube. I just have to find it. Stop sharing. Stop sharing. I should stop sharing. You can probably, do you see me now? Yeah. All right, stop sharing. So I'm gonna, yeah, go here and find my, I just thought of the video because you asked me how to map. Maybe I can show you that. It would be so nice and so easy. Here we go. This is a video. You have any question? Any question? The Greeks, we are everywhere. We were the one that created the lymph techniques. I'm going to show you a little video, and then you're going to ask me all your questions, because we already did an hour here. Okay, if somebody could go into their chat and tell me if you are full screen with the video. Somebody can tell me you could see the video. Is that full screen? Yes, perfect. Okay. So let's go and start, and hopefully the sound will come up. The sound is next up. Connect and feel the. Here we go. So practice, if you want to connect and feel the intrinsic rhythm, the contraction of the lymphagia, it's going to take at least one level. The first level of lymph, slow, gentle rhythm. In the second level, after some time, you could begin to attune to the direction. Here, the flow is going towards the inguinal area, totally normal. It's going to take a little time to do that. But what we have, if you go close to the spine, is an abnormal flow of lymph and interstitial fluid. Normal flow is going away from the spine. Normal flow is away. The flow is going to a different area, but away from the spine. If we try here, close to the spinous process, a lymph flow is going towards. Going its way. The spine is abnormal. The direction is going towards the spine. What happens when you have those pathological flow of lymph and interstitial fluid is the leg usually is limited in its range of motion. Here, that's really barrier here. And you learn to open the inguinal. There's a whole little protocol. See how gentle. Switch that flow of lymph. How gentle as a stroke. The path of this resistance. The lymph and interstitial fluid in the area eventually will switch to a new direction. And right now, the flow switch is fairly fast. And the other one is the same way. And usually, when you do that, when the flow is not going the right direction, the range of motion can change here. You see the difference? It's pretty spectacular on this case, but I don't have the barrier. It's just easy for me. And this can be applied to local pathology like that, or a lymphedema, or edema of any original. It could be even in the back of the eye if you have a trauma or any area of the body. Thank you. All right, that was 2 minutes. So basically, you can switch the lymph like this anywhere on the viscera if you don't have fibrotic tissue. If you have an old pathology with a lot of fibers, the lymph is going to be stuck and have a hard time to go through the collagen fibers. So you may need to do other technique first, okay? So I have a few questions. Number one, do you think everybody can feel this? I think we train 12,000 students, maybe 15,000 with Europe and North America. And most people, I mean, maybe not 20 years ago, it was kind of new, but today, because many, many more people are feeling it, there's a collective now around it, you know, I think 99% of the people feel the flow. Maybe not the first day, maybe the second day or the third day of the class, but usually most everybody are going to feel the flow. Our next question is, if it is sympathetic, what is sympathetic? There's a sympathetic innervation to control, but when you palpate with your hand and slowly restimulate lymph flow, and you see, you cannot say now that the lymph flow is a passive medium. You can still hear that in many books, scientific books, physiology books, osteopathic books, you know, the lymphatic system cannot move on its own. You need to breathe to make it. But so now you have a intrinsic movement. That's what you need to do, re-stimulate the natural automotoricity or lymphangiomotoricity of those little vessels. That's all you need to do. You don't want to press on the lymph like moving toothpaste out of a tube. So you have a sympathetic innervation. You have also dopaminergic innervation. You have different innervation. But when you slowly move the lymph and touch, go on and off with the touch, you are going to create a relaxing parasympathetic response because 0.1 hertz is an amazing rhythm with a lot of health qualities. When you go into 0.1 hertz, you calm down baroreceptor, you calm down cortisol secretion, you increase immune response, you increase a lot, you balance a lot of hormones, vascular things, peristalsis, brains, there's a lot of things with 0.1 hertz. It's an amazing rhythm. So bringing someone back into 0.1 hertz is absolutely amazing. Do you think it might have an intrinsic nervous, like the guts? Yes, you remember I said the lymph has a pacemaker cells. So this rhythm is pacemaker. Independent from the central nervous system, yes, because it's a autonomic response within the cell. Any more question? Anyone? That was an hour, so it was pretty nice. I know you had a lot of information, and again, we are going to put it on the YouTube. Look at maybe you Chikly, glymphatic. You do that on YouTube, you probably get the video very fast. Once you feel the lymph rhythm, you can ride the wave and have a lymphogasm. Lymphogasm. A lymphogasm, you met, right? A lymphogasm, absolutely so nice, and like you could see the hand is so relaxing for the practitioner and for the student. Now, to drain inside the brain is going to be a little more advanced, but draining the lymphatic outside of the central nervous system is going to influence, drainage of these glymphatic pathways and cerebral extracellular fluid. And then later on, you can work maybe inside the brain itself with the glymphatic pathway directly. Because by working with the glymphatic pathways, you could feel what kind of toxins is in the brain. And you could say, oh, there's too much this type of food. You have too much milk in your body. There's too much, you don't absorb it. You have too much red dye. You have too much this medication. You have something sometime in excess is going to be found in the glymphatic pathways. So by attuning to what is inside those pathways, when you're more advanced, you will be able to have an idea of what is the toxicity this patient needs to avoid, and you can drain that out of the system. Old antibiotics that took 4 months or years, you can drain that out of the system. But if it's a red dye, you says, stop eating ketchup with artificial red dye, stop having those drinks with artificial red dye, stop having pills that are pink, try to ask for a different brand, or, if there's red dye, or if whatever you can find. Thank you so much for the lecture. Please let us know when it's in YouTube so you can keep sharing. Guys, you'll have it in YouTube within 48 hours. Just look into YouTube in 48 hours, and you probably just put, I have, we have about 200 videos almost in the Chikly Institute videos. Add, glymphatic, Chikly, meningeal vessels, and you'll find it. All right. Is it time to say goodbye? Even though we don't want to say goodbye to the Greek people, we want to stay in Greece with you. Hi, Carmen.
Let me know when you go back to Greece.
Yes, we're gonna go next year. We're gonna come back next year. Are we good, guys? No more question. Did you enjoy the presentation? I'll do one that's going to be very close next week, so you don't need to. But maybe with the EFFO or some, they were talking with it. Or anyway, I'm gonna do one webinar every month. So this one again is brain, cranial rhythm, and bone marrow, with the motility of the bone marrow influencing the lemniscate movement in the body, influence the cranial rhythm, showing you the cranial rhythm applied to the muscles, to the artery, to the veins, to the lymphatics, cranial rhythm with the viscera, things you have never heard of. That's going to also blow your mind. It's going to be a good class. After that, in July, we're going to do BMTA, brain, bone marrow, toxins, and allergy. And you learn a little, maybe 15, 20 minute treatment to help people with allergy. It used to take me a lot of time, but with this protocol is quite fast. 1 treatment, 2 or 3 for allergy. Who will say hi from Russia? Perfect. From Russia with love. All right, everyone. Be safe. Enjoy your day, even if it's 2 a.m. for some of you. And thank you for participating. And we'll see you on another webinar. Thank you, everyone, for coming. Great. Thank you.